Hello and welcome to the Dissect and Connect podcast. I'm your host, Mike Wade. This is the podcast where we explore population health issues impacting your community. Dissect and Connect is a service of New River Valley Community Services and the Montgomery County Prevention Partners. Laura Kate Jennings-Brink is the Southwest Regional Hepatitis C Coordinator with the Virginia Department of Health. Laura Kate received her bachelor's degree in biology and bioethics from the University of Virginia, and her Master of Public Health and Epidemiology, along with a graduate certificate in health promotion from Liberty University. In her job, her role is to provide linkage to care support, case management, epidemiologic research, and data management for clinically diagnosed hepatitis C patients in Virginia's Southwest region. Laura Kate was born and raised in Roanoke, Virginia, where she still lives with her husband and her 6-month-old golden doodle puppy, Leo. When she's not in the office, she enjoys teaching fitness classes and swim lessons at a local gym, as well as volunteering with her local EMS agency as an EMT. So Laura Kate, welcome to the Dissect and Connect podcast.
Thank you for having me.
Great to have you here. So first off, let's talk a little bit more about your position with the Virginia Department of Health. I've already shared with the audience that your primary focus is addressing hepatitis C, or Hep C as it's sometimes referred to. Can you talk a little bit more about what you do exactly in this role?
Absolutely. So I am a regional employee who, for a lack of better words, tracks hepatitis C in the region. So my region is the southwest of Virginia. So I go from about Lynchburg all the way south and west, all the borders, as far as it goes. So when you look at a map, it's about half the state. It's a big territory. So that's what I do. Anytime someone tests positive for hepatitis C, whether it be an antibody test or an RNA test, they get sent to the health department as a reportable disease, and then they get sent to me. So I log all the data and I reach out to the patient, see if I can get, some risk factor information from them, and then see where I can refer them out to, whether they need food services, if they have a food insecurity, or addiction services, or even hepatitis C treatment. That's like the main one that I always try to get to. So that's basically what I do. And then all of that data gets sent to the central office and to the CDC. And that's where all of the big charts come from, the data that, a lot of authors use to kind of describe the opioid epidemic or health insecurities or inequities, stuff like that. So that's just a little bit of what I do. I know that's a mouthful, but it's quite a job, to say the least.
Yeah, and that is a really impressive area of territory that you're covering. That's significant.
Yeah, it is. It is. I think the state splits it up based on the amount of people in each area. So our northern region is a lot smaller. And then I guess as people come southwest, they get more spread out.
Right.
But yeah, it's a lot. It's a lot.
And how long have you been in this role?
So I took this role over probably about a year ago, right in the smack dab middle of the pandemic.
An interesting time to get started in the job.
Oh yeah, it was very fun. Very fun times.
And I definitely want to come back and talk about COVID-19 and its impact on hepatitis C a little later in our conversation. But for now, especially for folks who aren't familiar with hepatitis C, although I would guess most of us have heard of hepatitis C or Hep C, can you provide our listeners with a basic overview of hepatitis C and what that is exactly?
Yeah, so hepatitis C, I'm sure a lot of people have heard of the varying types. So you have hepatitis A, B, C, and there's even a D. And it's basically an inflammation of your liver caused by a virus. And so while it might not be an emergency right now, over the long term, it can cause a lot of damage, like liver fibrosis, which is like a death of the liver tissue, and even cancer, ultimately resulting in death. So it's very interesting in that it's caused by a virus, and there's all of these different types that are actually transmitted in different ways. So I'm sure we'll get into it a little bit later, but for example, hepatitis A is often transmitted through an oral fecal route. So if you're drinking contaminated water or your food that you got at a restaurant is contaminated, that's how hepatitis A is spread. And it is a different type of virus. And that's what differentiates the A, B, and C.
So can you talk a little bit about the prevalence of hepatitis C?
Yeah, so in recent years, I feel like most people have probably heard about hepatitis C or different populations that might be at an increased risk. So a couple populations that are at increased risk that you wouldn't necessarily think of are the stereotypical baby boomer population. So those are those people that were born 1945 to 1965. And no one can quite figure out exactly why that is that they have a higher prevalence of hepatitis C, but it's just one of those things. They get tested, treated, knocked out. But as far as national data, I pulled up a map this morning, and I'll give you these resources too, but it basically is concentrated exactly where you think. If you know anything about substance use disorder or the opioid epidemic, it's kind of concentrated in those Appalachian states, right? So the southwest part of Virginia, West Virginia, Kentucky, North Carolina, Tennessee, those kind of like mountainous states, and it kind of piddles out in the Midwest a little bit. And it is concentrated in those far western states, so California, Nevada. So as far as a state, as far as Virginia, 2019, our overdose mortality was 18.3 per 100,000. 2019 is probably the best data we have for that, but that's a pretty high overdose mortality. And then an even better picture of opioids and the effect of hepatitis C is in 2019, 36.9 opioid prescriptions were prescribed per 100 people. So that's a direct correlation there. But as far as our state rate as a whole, we have 133.1 cases of hepatitis C. These are new cases per 100,000 residents. So that's a pretty high number. Of course, it varies across regions. I pulled our state numbers for the whole state, and in 2019, we had 11,533 new cases in the year of 2019. 2020, our data gets a little fuzzy again because of the pandemic and things like that. But more specifically, I think, and the big kicker here is that in Southwest Virginia, there's a much higher prevalence and a much higher incidence, so a number of new cases in Southwest versus the state average. So in Southwest, our case rate in 2019 was 231 per 100,000. So that's almost 100 more cases per 100,000 in Southwest. And then I even went a little bit further and pulled some from the New River Valley, which are quite astounding. So in Floyd County in 2018, so these are a little bit dated, but in 2018, there were 464.2 cases per 100,000. And it even goes up as far as in Pulaski County, 753 cases per 100,000. So that is way higher than the state average of hepatitis C cases. And that just shows the concentration in that area and the risk factors that I'm sure we'll talk about a little bit later. But that's just a big picture kind of funneled down, if you will, into a much smaller area of the New River Valley.
You touched upon some of the potential health impacts of hepatitis C. Can you talk a little bit more about the short-term and long-term health implications of having that disease?
Absolutely. So short-term, there's not very many short-term impacts. I mean, there are, weight loss is a big one, or yellowing of your skin and eyes. No one wants yellowing of your skin and eyes, or upset stomachs. Those are kind of more immediate impacts shortly after your initial exposure. More long-term, if it's not treated, you start getting into the death of the liver tissue. And the liver tissue really does a lot of work with filtering your blood. So as time goes on, that liver tissue kind of dies off, and you get a smaller portion of your liver that's really working and filtering that blood product. So you could get cancer. You could get liver fibrosis, which is just a fancy term for death of liver tissue. And ultimately, death, and you could get some infections that kind of spread through your body, which is called sepsis, due to, your liver not being able to filter that product as efficiently.
I think you mentioned too earlier when you spoke that there is treatment available.
Yes,
Can you talk a little bit more about that, what that looks like?
Absolutely. So in the earlier treatment days, probably 20 or 30 years ago, hepatitis C was treated with a drug called ribavirin, which is an antiviral. It was taken for a span of a couple months. The side effects were very severe: nausea, vomiting, diarrhea, weight loss, all the things you don't really want when you're trying to get rid of something else. But in the recent years, 2 new drugs have kind of come to the forefront of hepatitis C, and they are taken either for 8 weeks or 12 weeks, depending on which one your doctor prescribes. And the side effects are much less. So I have patients, instead of, losing 20 pounds in a couple weeks, they're like, well, the worst thing I have is a headache in the morning and it subsides, or some nausea.
Mm-hmm.
And so these drugs are amazing, and they, like I said, the side effects are much less. So it's a great evolution of science to get to this treatment. Very treatable at this point.
So once someone receives treatment, if it's effective, are they then considered cured?
They are.
Okay.
So the general process is someone will be tested for hepatitis C with an antibody test and an RNA test. And the RNA test basically tells us if they have a current infection. If they have a current infection, then they're eligible for treatment. And the treatment, it'll be 8 or 12 weeks, and your doctor will test you at the end of that regimen to make sure that your viral load is close to 0. And if it's close to 0, you are good.
Okay.
That doesn't mean that you can't be reinfected
mm-hmm.
or re-exposed to it. But in that moment specifically, yes.
Can it be prevented, or are there ways that we can avoid getting hepatitis C?
Yes. So that is a good one. I always try to tell people hepatitis C is kind of unlike its counterparts of hepatitis A and B. Hepatitis C is spread through blood products. So we see this a lot in people who do recreational drugs, where they share recreational drug equipment like needles or cookers or anything like that.
Mm-hmm.
It can also be spread through things like sex, where, blood is exchanged. Any type of activity where blood can be exchanged. Needles from a tattoo parlor that weren't the cleanest,
mm-hmm.
and they might have been reused from another person. Stuff like that. So the biggest takeaway of how it can be prevented is cleaning those things with bleach,
mm-hmm.
getting new ones if you can, always wearing a condom, just being smart about blood exposure.
Right.
Is the biggest takeaway of preventing it.
And those activities, those behaviors, those risks that you mentioned, would those things be what you attribute the higher numbers in Southwest Virginia and the New River Valley? Would you attribute those higher numbers to those type of activities?
Yes, I think I would. It's always a little bit of a game you play, by putting all your eggs in one basket, but because there is that older population that just so happens to get it. But
mm-hmm.
all of our data at the health department points directly to the coinciding of opioids and the rise of recreational drug use, IV drug use, and then the rise of hepatitis C.
You mentioned baby boomers being more susceptible to developing hepatitis C.
That is really the only one, is the baby boomer population, and then those people that I guess participate in those specific behaviors that might increase their risk.
Right.
Other populations that might be at risk for hepatitis C, and it's not as common now because blood products are screened so well if you are to get a blood donation or a transfusion, or even an organ donation. Those populations that have received those, I think it's prior to, I want to say 1990, those populations might be at an increased risk. So definitely, if you are a person or you know a person that's had a blood transfusion or a blood donation, organ transplant, anything like that, prior to that year, probably definitely get tested at least once.
We talked earlier about the rates of hepatitis C, and I'm guessing that at this point it's probably way too early to know for sure. But I wonder if you might have any thoughts about how those rates could be impacted by COVID-19.
Yeah, so like I said, I started this job right in the middle of COVID. And my predecessors, I guess is the correct word, they were working actively on hepatitis C since about 2019 was when my specific position was founded. And that's the best data we have. But just to, I guess, emphasize what COVID did, in 2019, like I said, we reported over 11,000 cases. And in 2020, we reported 4,000.
Mm-hmm.
So there's a drastic increase or a drastic decrease. And, you and I both know hepatitis C is not going anywhere.
Right.
And as we saw from that New River Valley data, it hasn't gone anywhere. I think, has a lot to do with the places that were normally testing for hepatitis C were not.
Mm-hmm.
Their efforts were focused on COVID. The health departments, it was a lot harder to get services from the health department. We at the health department do test for hepatitis C, and a lot of places that did hepatitis C treatment were unable to do that as well. Mm-hmm. So the testing wasn't going on, so the reporting is a lot less than it probably should be. So it definitely was impacted. And I think going, on the flip side of COVID now, hopefully, we're starting to see those rates of testing kind of pick back up.
Mm-hmm.
And reporting. So hopefully we'll have some better data at the beginning of 2021 and onward. But yeah, reporting definitely decreased as a result.
And I would imagine, too, since we saw such a significant climb in overdose numbers over the past year, that some of that's probably going to parallel and show up in hepatitis C numbers, wouldn't you think?
Oh, definitely.
Yeah.
Definitely.
Yeah. Well, let's try to take lemons and turn it into lemonade. Is there anything from a public health perspective that we have learned from COVID-19 that will help us better address the issues related to hepatitis C moving forward?
Yeah, I think, at least from my perspective, there's always something to be learned. And I think we learned that at least in Southwest Virginia, there are not enough places to go get treated. There are a couple in each district, and that's just not enough. We have, in some places a 2 or 3 month waiting list. And with these populations, there's just not that much time to wait. If someone decides they want to get treated, they might be in a stage of life where it's now or never.
Mm-hmm.
And so really bolstering up those resources for those people to be able to utilize and be able to mitigate the spread, because it really doesn't do much if it takes a couple months to get back to someone. They could have given it to all of their friend group by
Mm-hmm.
that point,
Mm-hmm.
So from a public health standpoint, it doesn't really do much to have a wait and a lack of resources. So I think bolstering up those resources and educating providers about really how easy it is to prescribe a treatment. It used to be that you had to jump through all of these hoops to get a treatment, and only certain providers could do it. You had to be an infectious disease doctor or a hepatologist. Now, your PCP or your primary care doctor can test you and prescribe and have you out the door. So just getting those family practice doctors to realize really how easy it is
Mm-hmm.
would really bolster up our treatment options.
Yeah. So speaking of treatment, what about the costs associated with treatment? What does that look like?
Yeah, this is a hard one. The cost associated with treatment is pretty hefty. The good news is most people, at least from our partners at the Department of Social Services, most people are actually eligible for Medicaid.
Mm-hmm.
Even if they haven't applied, they most likely are eligible, or there are financial aid options available throughout
Mm-hmm.
the valley for people that aren't eligible for Medicaid and are uninsured.
Okay.
But the price associated with that particular, just the meds alone, the meds cost about $10,000 for the 8-week or the 12-week treatment, respectively. Yeah, so they're very pricey, but don't let that discourage you. There are definitely options, either through financial aid or Medicaid, and Medicaid actually covers the entire cost
Okay.
of the regimen.
Okay.
So that is lemonade for sure.
Yeah, that's good to know. And I would imagine too, with some of the populations that we've talked about, a lot of those folks are actually Medicaid eligible or are already receiving Medicaid benefits.
Exactly.
So let's switch gears for just a moment. May I ask why you chose this particular career path?
Yeah. So in the beginning, I was pre-med. I was going to go to medical school and be a doctor. And I feel like that's the stereotypical thing that most people want to do when they grow up, right?
Yeah.
It wasn't until probably my master's degree, actually, where I started to kind of be more interested in germs and diseases and kind of the statistics of how diseases affect certain people, certain populations, certain races. It was kind of interesting looking at, well, why is it that a certain population has a disproportionate burden of heart disease? Well, I don't know. Let's look at the fast food restaurants that are surrounding that community. It's kind of interesting as you dig further into it. And the further I got into it, the more interested I became. So that's just a little bit of how my brain works. My brain works very much so of, well, if this happens, then I need to figure out why. Okay. And then I can go deeper and figure out more of why kind of thing. And then I can solve the problem in a perfect world.
I mentioned in the introduction that you also volunteer as an EMT. I'm curious to see and hear a little bit more about what that experience has been like.
Yeah, I got my EMT certification when I was 18, so I was very young. And I kind of was inspired by my dad. My dad was an EMT and a firefighter in our hometown of Roanoke, and it just always seemed like something fun to do. Helping serve the community, getting to see a lot of new things, making a ton of new friends. And it actually has turned out to be just that for me. I've made some of my best friends. I have seen, some wild stuff and some crazy things, but it has really turned out to be a fruitful way to serve the community that I live in. Yeah. So that's my ultimate goal, is just to have a positive impact and serve the community in whatever way I can, whether it be hepatitis or EMS or fitness classes at 5 a.m., whatever it may be.
Well, that's highly commendable of you, Laura Kate. I'm curious, though, from looking through the lens of an EMT person and working for the Department of Health, as you take kind of a broad scope, a broad look at overall community wellness, what do you think some of the biggest challenges are for this area of the state?
Biggest challenges. I think the biggest misconception that I deal with is that, and you might be able to relate to this, is that Virginia stops at Roanoke and everything past that is kind of no man's land. Mm-hmm. So the biggest thing that I have dealt with is just the utter lack of resources. And it's not to say that groups don't exist that want to help and can help, but I think until the entire state or the entire country even acknowledges that this is a problem and, health inequities exist in these populations, it makes it a lot more difficult to address and to even work with, smaller coalitions or groups that want to do the good work, because, you need funding, you need media attention, you need all of these things. And when, you have people that have never left Roanoke or never gone as far southwest as some other people actually live, you don't really know what it's like. So that's the main barrier that I have seen. And I think it really is gaining a lot of attention, especially in recent years, with the heightened attention towards, overdoses and substance use disorder and this opioid crisis that we kind of find ourselves in. And the more books that get written and the more, TV shows that we see that kind of make a play towards it, it just kind of helps to increase that attention that, Southwest Virginia really does need. It needs the attention. And the attention is going to be how we get these resources to the people that need them.
What you've spoken about is right on target, because I think when you talk about a lack of resources and you talk about those health inequities, you have things like a higher prevalence of hepatitis C and a higher rate of overdose because people just aren't connected to resources and supports.
Exactly.
So these problems that you and I and some of our counterparts work on are really just symptoms of that bigger issue that you mentioned, I think.
I would agree with that.
Well, hey, what about some resources that you might point people towards, our listeners, whether it be websites, books, what have you? Anything to recommend?
Absolutely. So there is a really great website that kind of puts into visualization the data that I've mentioned, because numbers can be hard, especially in a podcast where it's all just kind of floating around. But the website is called hepvu.org, and it's HEPVU.org. And it's this group, this nonprofit group that has compiled data from all across the country and put it in a visual format. So it really is easy to understand how Hep C is spread out. It even has things about opioid overdose or even, deaths because of hepatitis. So that it really can put it into perspective. And you can go click on state-specific data. And like I said, the data is a little bit lagged in years, but that's a really great resource. And if people are interested in what they can do for their community, or even there is a hepatitis roundtable. So it's called the National Viral Hepatitis Roundtable. And it's just a bunch of community members, whether that be doctors, lawyers, pharmacists, people like you and me. They meet and they have a conference and kind of talk about what the trends that they're seeing. They collect data, and they're really a great patient advocacy group that is on Capitol Hill, kind of, trying to get these resources to the people that need them. So that's another really great one. Virginia, my group of people, is actually trying to create a hepatitis coalition in the state of Virginia. So that is one thing that's kind of up and coming. And I don't even think they even have a website yet. But the Virginia Hepatitis Coalition is kind of up and coming, and hopefully we'll have statewide partners that can kind of offer guidance and advocacy towards that as, time progresses and things get a little bit back to normal from COVID. And the biggest one that I can recommend is reading Dissect. And Mike, I don't know if you've read it.
Yep.
But it is probably my favorite book ever in the history of favorite books. It's so good. And Beth Macy really just paints that picture of Southwest Virginia that I think a lot of people need to understand. And there's actually an HBO series that I just finished a couple weeks ago. And it's called Crime of the Century. It's on HBO. It's on HBO Max. And it actually is based in Wise. They go to the Wise Rescue Squad and talk to a bunch of the guys there and ask them what they're seeing, if they're seeing overdoses and how and why, and kind of just, again, draws that attention towards that specific population that needs that attention.
Great. I'm not familiar with that one. I'll have to check that out.
It's really good.
Yeah. And we actually had Beth on for an episode of the podcast about a year ago now. She was great to talk to. Yeah. And that is a great book. So I'll include links to all of these in our show notes for today's episode.
Cool. Awesome.
Yeah. Thank you for those. And just finally, as we wrap things up, do you have any parting words of wisdom to share with our listeners?
I guess the best thing I could say is that, we spent, an hour-ish, 40-ish minutes talking about these specific populations. But I think, and the CDC recommends this, that everyone, at least once in their life, should be tested for hepatitis C. So don't neglect that test. It is treatable, and it's not a cause for worry, because it is treatable. It is totally, as I like to say, figure outable.
Okay.
So you can definitely figure it out and treat it and get it all worked out. And I would probably say pay attention to those special populations, because they need support And that's the way we're going to get through this opioid crisis, right? Is just supporting the people that need it and getting them what they need.
And to pay attention to those ancillary health issues that come up, like hepatitis C.
Exactly.
Not just the core substance use disorders, but everything else that they face in those challenges.
Exactly.
Yeah.
Yep.
Laura, Kate, thank you so much for your time. Have really enjoyed our conversation, have learned a lot, and certainly appreciate everything that you're doing through the Department of Health to call attention to hepatitis C.
Thank you so much for having me. I feel honored.
Would love to have you back on the show at some point.
Yeah, definitely.
We hope you've enjoyed this episode of the Dissect and Connect podcast. To learn more about Montgomery County Prevention Partners, our New River Valley Community Services, be sure to check us out on Facebook or visit nrvcs.org/podcast.